now. Recording in progress, because I'm always paranoid I'm going to get halfway through a presentation and be like, oh no, I forgot to hit record. So I'm going to get my little slides shared here. Okay. So I'm Cheryl. I just love this little graphic I had someone make. And I am the founder of Arthritis Life. It just sounds so official when I say it like that. And so this is the Welcome to Rheumatoid Arthritis webinar. So it's going to be like a mixture of, I'm going to give you a big brain dump of information about rheumatoid arthritis. A lot of it is also pertinent to psoriatic arthritis and ankylosing spondylitis, which are like the two most closely related conditions. But I also want you to know that you can, we're also going to have time at the end for general Q&A. So if I didn't cover something that you wanted to just ask about, that's totally great. And if you have any questions, I don't mind actually people raising their digital hand or writing questions in the chat. I know some people say, oh, hold your answers to the end or hold your questions to the end, but I like answering, I like at least knowing what they are as I go along. Because if I know I'm going to answer them later, then I'll say, oh, just hold on a few minutes. But, and just, it's nice. Just, I don't know if you're like me, but if I have to hold my questions to the end, I'm probably going to like forget what my question was. So, and you're in the right place if you have a rheumatic disease. There's always different names for these diseases. There's people call them rheumatic disease. They call them inflammatory arthritis. They call them autoimmune disease, autoinflammatory disease, or they'll just call them by the names, rheumatoid arthritis, psoriatic, ankylosing spondylitis. And if you're confused or overwhelmed, which is a very, very normal reaction, having difficulty coping or feeling a little bit like you've been left on your own, or maybe you're kind of somewhere in the middle, like, oh, I'm doing okay, but I just kind of am like this little picture. I don't mean to be depressing. Like not everyone feels that way, but quite a few people do. They're like, wait, I just got this kind of like bomb dropped on my life. And then I have to come back on 3 months. Like I have all these questions. I don't want to wait 3 months. Right. So this is kind of why I like to do these, is just to provide some sort of support and education in the meanwhile. But I will give my little medical disclaimer, because this is not medical advice, not a substitute for medical appointments, but I'm going to give you a basic introduction and welcome to rheumatoid arthritis, a little bit of information about it, and then some tips for navigating your new normal, not just physical, but also kind of mental and organizational tips as well. And then some more resources at the end. So, and this is a little obvious, but I always try to get to the so what, like, what's the point? We want to learn about how to manage it so that we can actually improve our quality of life and our well-being. And actually my little tagline that I try to achieve. Now, emphasis on try. I don't achieve this every day, but I try to figure out how can you live a life you love despite rheumatoid arthritis. And that sounds like, yeah, duh, but a lot of times what people get caught up in, and we'll talk more about this, is this idea of, well, I have to like control the disease or cure the disease or heal it, then I can have a good life. And it's kind of like the disease is this obstacle that you have to like annihilate, right, before you can engage with your life. And my goal, what I've learned through having this for 19 years now, is that it actually can be a little bit more productive and healthy for you to mentally to say, okay, maybe this obstacle of rheumatoid arthritis, maybe it's just gonna be there. Like, and I'll do my best to get in remission. I'll try everything, but sometimes it's still there, and we've done all we can. But that doesn't mean that we then just give up, right? We still can say, okay, I might have these symptoms today, but what's still possible in my life? So that's a big kind of philosophical approach. But just a quick intro, because some of you I've already known from social media, but some of you I maybe just saw, like I did a little Facebook. It wasn't even a Facebook ad. It was like a boosted post. So maybe some of you found me through that. But so I am Cheryl Crow, the arthritis person, not the singer. And I've had rheumatoid arthritis for 19 years, since I was 20 years old. So I'm 40 now. But I'm turning, yeah. So it's confusing because I got diagnosed right before my birthday. And I have a master's in occupational therapy, which, if you don't know what that is, it's actually, I like to say that we're like life skills therapists. So sometimes we're confused with physical therapists, and we definitely do overlap with them to some degree, but we really focus on like everyday living skills and how your condition, illness, disability, health challenge impacts all the minutia of your life. Like literally how to do your hair when your hands hurt from arthritis, how to put your dog's leash on, how to take care of children, the really practical living skills. That's what our expertise is in. And I will be honest, people always say, oh, did you become an OT because you knew it would help you with arthritis? And I was like, actually, no, because I was never referred to OT as a patient. I had rheumatoid arthritis for 6 years before I became an occupational therapist, and I wanted to work with children with developmental differences or developmental disabilities like Down syndrome and cerebral palsy. And that was like my life's passion. And I still really love that work. It became a little too difficult for me to balance my energy levels when I became a parent. I became a space parent when I had my child. I was like working with children that often had like challenging behaviors, and then having the energy to manage my own child while managing my autoimmune disease. I was like, this is too much. It was a little too much. So I had to cut down on that. But anyway, I had no idea when I went into OT school, occupational therapy school, how much I would learn for arthritis. So that's been helpful, but it's also like a little soapbox I get on because I think more patients should be referred. Anyway, so I also have a 7-year-old son, and I founded Arthritis Life, and I love patient education. That's like that's what I do now. So, how this fits in, what we're talking about today, a lot of the tools I'm going to talk to you about kind of fit into 2 programs I've created. So there's the Rheumatoid Arthritis Roadmap, which is like a self-paced course, and a Room to Thrive support group program, which includes like live sessions. So I'll explain that more a little bit in the end, but I just kind of want to put the bug in your ear. Okay, why is it so hard to adjust to a condition, a new diagnosis like rheumatoid arthritis? By the way, if you've had rheumatoid arthritis a long time, that's totally okay too. This is it's kind of like designed to be a welcome session for newly diagnosed people. If you want to say in the chat how you're totally welcome to, again, I don't want anyone to feel like they have to disclose any medical information they don't want to. But if you would like to disclose like if you're newly diagnosed or you've had it for a while, however you define that, you're welcome to do that. Actually, yeah, I guess I don't know where my slide is that talks about the medical disclaimer, but this, I guess I must have accidentally deleted it, but just to say verbally, this is not a substitute for medical advice. I am a licensed health provider in Washington State, but this is like I'm providing general education and advice today, but this is not a substitute or medical advice. So a few people, diagnosed in 2015, diagnosed for a year. And so Rebecca, talking about you've had it for a few years, and it's actually really hard sometimes to draw the line in the sand. Like, when did you actually get it? Like, I started feeling really sick and deconditioned over the course of like 2 or 3 years before my diagnosis. But some people, it hits you like a tornado, like they're 100% functional one day, and then the next day they wake up and they can't move. So it can be a different kind of onset. And then there's a few people who've had it, and thought it was carpal tunnel. Yep. Someone in my Room to Thrive group right now, she actually got carpal tunnel release surgery, and she didn't have any other symptoms, just wrist. And they found rheumatoid arthritis in the cells of her wrist, which was how she got diagnosed, which was really interesting. Okay. And we got a lot of people diagnosed kind of in the 1 to 2 year range, and then a few in like the 4 to 6 range. So, and then, someone just got diagnosed in August. Well, welcome. I'm hoping to give you a lot of information. I will just say, if I was going to critique myself on what I'm about to tell you, I'm trying to tell you way too much in a short period of time, but that's why I'm recording it, and I will give you the recording and you can watch it and then like pause or like hit the slow down button to try to like listen, because I do talk really fast. And you have a baby. I think I got diagnosed when I was 20, and then I had my child when I was 32. And I think being diagnosed postpartum has got to be, we're not going to play the suffering Olympics like we've all suffered, let's say, but I think that's got to be one of the more difficult life experiences. So my heart goes out to all of you who were diagnosed with a baby, because adjusting to becoming a parent is hard enough. Then having to add in your condition is a lot. So, and diagnosed in July. And Colleen, you're more of a veteran than I am. So you've had it for 32 years. So feel free as we go along, chime in. And there's a saying in chronic illness management in healthcare that, patients become the experts in their condition. You're the expert in how your condition affects your life and what has worked best for you. So please, I honestly, every time I do one of these free talks, I learn something. I really do. Actually, one of the things I learned last time I did one about life hacks was about a hairdryer stand. Anyone ever seen these? You can put your hairdryer in it. So instead of having to hold your hairdryer, you wedge it into the stand, and then it's something you could just move your head around. You don't have to hold your hair. That's like so many things you might have heard about that I haven't heard. So anyway, so this is preaching to the choir, but some of the reasons it can be hard to diagnose to rheumatoid arthritis is information overload, especially those who've kind of gone down the Google rabbit hole. And I think one that doesn't get looked at enough is unknowns, right? So many unknowns, right? And how fast is it going to progress? How long will it take to find a medication? When you finally start a medication, how long is it going to take to work? And then there's the social effects, having explained to people. I just did a funny little video about, not drinking alcohol because I'm on methotrexate. And it sounds a little bit silly, like, oh yeah, like, well, it's not the end of the world, but all these little social effects add up over time. I remember thinking, gosh, it was like a month before my 21st birthday when I got diagnosed. And then it's like, okay, go on this medicine where you can't drink. You're like, I'm almost 21. Like, I almost made it. And then of course, how it affects your work life and your job, and yeah, when you're young, and then people are like, it's just arthritis. Like, what are you talking about? Or like, you're not a grandma. Why do you have arthritis? Like, that's the things people say. I'm not saying that's nice to say. And then there can be a lack of clarity from your medical team or different providers, confusing medical jargon, and just a big learning curve. And I just want to acknowledge that many of us, and I'm including myself, have had a degree of medical trauma. I don't mean physical trauma, like from a car accident or something, but trauma from being not believed or being told you're not sick, you're just anxious. Like there's a whole field now looking into like medical gaslighting, which is like when it takes about 4 to 7 years for many people with autoimmune diseases to get their diagnosis, which means, so in those 4 to 7 years, many, many times, and this happened to me too, that I was told, you're not sick, you're just hypervigilant, you're just anxious, you just need to go to therapy. And again, therapy is amazing. And now I've gone to therapy and it's great, but I almost actually, it worked against me that they kept saying that, because I was like, I don't want to go to therapy because I don't want you to think my problems are in my head. I want you to actually figure out what's wrong with me. So yeah. And I'm not even seronegative. Anyway, yeah, we could have a whole session, a venting session on this, but yes, seronegative absolutely can make it even harder to get the diagnosis. And so I'm sorry for those who can relate to that, but that can make it's like a whiplash. Like I went from being like, I have to try so hard to prove myself that like, I am really sick. I'm like, please help me. Like the analogy I use is like, it's like you're on fire or your house is on fire and you call the fire department and they're like, there's no fire. And you're like, wait, so like, who do you call then? If the fire, like if the doctor doesn't believe you, who do you go to? It's very confusing. So, and then you get this diagnosis and then you're immediately relieved, at least for me, because you're like, oh, they believe me. Like they think but then they're like, actually, okay, like 2 weeks ago, we were telling you that you're just anxious and you need to stop worrying about your health. But now we're actually gonna tell you have this very serious lifelong condition that's progressive and like, you have to go on these serious medicines. You're like, whoa, like what just happened? Like that was really fast. Like, so I'm feeling exactly the same and look exactly the same. And one day you're deciding I'm faking. And the next day you're telling me, now I will say there's a difference between a doctor saying that they don't know what's wrong with you or they don't find anything that's wrong with you and actual gaslighting where they're like, stop coming back. You're not sick. Like those are actually different psychological things. And those are different, like it is a doctor's job if they haven't found anything wrong to like tell you that they don't think that there's anything wrong, but so it's a nuanced thing. But the point is that there's a lot for us to adjust to. But what have I not even mentioned yet? Like what kind of experience of having, what aspect of having rheumatoid arthritis or similar? I've mentioned like social effects, job effects, mental stress. We haven't talked about the physical symptoms. So the actual pain, of course. So I'm laughing because it's like, it's a lot. Like people think, oh, arthritis is joint pain, but obviously you all know from experience, or if you're a friend and family member or a health worker that just wants to learn more, welcome. You're welcome to be here too. But, there's different kinds of pain. You have to learn to differentiate, I might be on the scale of 1 to 10, a 0 on the sharp and stabbing pain, but like a 5 or 6 on the dull and achy pain or stiffness. There's different kinds. There's different kinds of fatigue. There's mental fatigue versus physical fatigue. Like sometimes my brain is totally alert and awake, but my body is totally fatigued versus vice versa. Sometimes my mind's just totally gone, like with brain fog, and then my body's like, we're fine. So there's also the extra articular symptoms like, eye inflammation, lungs, and then medication side effects, and all that. So just know that you're not alone. Like if nothing else from this, if you don't remember anything else, there's a lot of others that feel the same way. And I think that's one of the positives of social media. So social media is a mixed bag when it comes to chronic illness, because there's a lot of misinformation, but like this one, I felt like I could have read it, but this was what someone said on Instagram. I've always been a super high energy, do it all person, takes care of others. And it's hard. It can take away part of your identity if you've gone from being the caretaker to then needing others to care for you, right? It can be hard to ask for help, or, hard to deal with people's comments. Like this person said, very few people in my life understand what I'm actually going through. So know that those are super common experiences. I'll send you the slides as well, so you can read them. But okay, now I'm going to go through again, very, very fast. So RA 101, because this is the kind of part that you can find online that's pretty accurate some of the time, but I kind of like to put my own spin on it. Okay. So what does arthritis mean? Just the word arthritis, if you don't already know it. Arthro is like the joint, which is basically the space between the bones. It depends on who you ask, like if they define like the muscles and the tendons as like a little bit of a part of the joint too, but like the joint capsule is the part in between the two bones. And then itis just means inflammation. So it's kind of like saying gastritis is like a tummy ache, right? Inflammation in your gastric system. A tummy ache could be from stomach cancer. It could be from indigestion, could be from food poisoning. In that same way with arthritis, arthritis itself isn't a diagnosis. The word arthritis is like a generic term for something that causes joint inflammation, but you have to know what the root cause is in order to know how to address it. So in rheumatoid arthritis, the root cause is your immune cells that are accidentally attacking your healthy tissue. And I choose to envision these as kind of misguided little cells that are trying to do the right thing, and they just accidentally determine that the synovial lining of your joints and the synovial fluid is bad. And so it's like, okay, here I come. I'm going to go attack these cells. And then unfortunately, the amount of these immune cells that come into your joint cause inflammation, which over time, that inflammation can actually lead to wear and tear and cartilage degradation over the cartilage that goes over the bone. But in general, initially, it's not considered like a mechanical arthritis. Osteoarthritis, in contrast, is from that bone on bone, where the joint space over time can get smaller. So there are over 100 different kinds of arthritis. A lot of times people do use the word arthritis as just a shorthand for any cause of arthritis, but rheumatoid is one of the autoimmune or autoinflammatory types. There's about 2 million people last time I checked in the United States living with rheumatoid. There's about 54 million people total. The vast majority who have a form of arthritis, the vast majority do have osteoarthritis. It's actually 1 in 4 adults in the United States has osteoarthritis, which is pretty staggering. But another thing that's important, I think again, a lot of you probably experienced this, but I didn't know until I went to occupational therapy school that my fatigue was actually from the disease itself. I thought it was like a medication side effect. It can be for like methotrexate in particular, but there's these non-joint or extra articular symptoms they include things like lack of energy and fever because it's inflammatory, sweating, poor appetite, and weight loss. Those are my first symptoms before I even had any joint symptoms, interestingly. And then I was, of course, accused of faking an eating disorder, which was fun. But no, I was not. I was like, I can't eat. I'm trying to eat, but I can't. And anyway, I'm still processing these feelings from 19 years ago. AKA, that's why I say therapy is good, because I never even thought that my issues with being medically gaslit would be like bad enough for therapy. But then it's kind of like they say, when you get to therapy, once you start talking, you're like, oh, I have feelings about this. Yeah, in the chat, I'd love to hear some of if you have any symptoms that are the non-joint symptoms. There's the dry eyes, which I also didn't know for a long time were related to rheumatoid arthritis, heart or lung issues. And then again, over time, it is important to know that people with rheumatoid arthritis do have higher rates of depression and or anxiety. Again, to me, it's definitely, if you're a result of living with this kind of condition, right? It's not that your depression or anxiety caused it. It's just that it can be difficult to live with pain and fatigue. So if you have any others that aren't mentioned here, let us know too. But a little lingo that I wish that I had learned earlier, I kept saying, what are people talking about flare up? Like, what is a flare up? So a flare up is not a term that is actually like medically defined. There isn't a consensus on exactly what constitutes a flare up, but most people define it as a period of time. That's the part that's non-defined. Is it a week? Is it a day? Is it a month? A period of time where you feel worse than your baseline. So the people might say just one day, I woke up today and my joints are flaring today. They also might say, like my doctor has asked me, do you think are you having a like sustained flare up? Like, is it not just today and a week, but it's like things are getting progressively worse. And Colleen, I'm sorry you also experienced that poor appetite that I did too. Yeah. Another thing to know is that when people say remission, again, there's different ways of defining it. So you do want to ask your own medical team how they define it. But in general, it's a period where you have either no symptoms or very low symptoms. And some also define it as no blood markers as well, or no findings on like ultrasound and x-ray. And your disease is not considered active. So for example, I was in what's called medicated remission. My first 7 years of having RA, I was on 𝗪𝗪𝘃𝗃𝗍, and I had no joint pain, no fatigue, no deformities. And that's medicated remission because I was in remission, but I was on medicine. There are people that go into unmedicated remission where they're able to control the disease with lifestyle, nutrition, stuff like that. That's very rare, but it is possible. The rate of that is about the latest that I've got word from the rheumatologist that authored a couple of different journal articles I can send you, is that's about 5%. So 5% of people with rheumatoid arthritis can sustain long-term remission without any medications. So I like to tell people that because there can be shame around taking medicines or fear, but there's a lot of good evidence about the effectiveness of these medications. So that is why I went on early and aggressive drug treatment for my rheumatoid arthritis. And typically over time, rheumatoid arthritis is characterized by fluctuations between periods of flaring up and remission. So that's the normal. Even before we had the good medicines we have now, people did have that kind of ups and downs as part of the normal course. But over time, it is considered progressive if you're not able to stop the disease or slow it significantly through the medication. So the medications now have really significantly changed the prognosis, or what the doctors will say, what's your long-term, what you should expect to experience long-term. Like I know when I got diagnosed, my doctor's like, we want you to try to we want to control your rheumatoid arthritis through medications and whatever else you can do, exercise, healthy eating, stuff like that, to where you can live as normal of a life as possible. And that's not something that they could say like in the 80s and 90s because they didn't have as good of medicines. So, but the not so good news is that even though the medicines overall have been game changing for the rheumatology community as a whole, they don't always work for everyone, and they can have side effects that are not worth it for some people. I'd rather live with, deformities or pain than this, nausea or other side effects. So, but the good news, again, this is me going back and forth, is that, the prognosis has never been better. So, and that's something to think about when you get confused on social media or looking online about rheumatoid arthritis. Really be careful that you're not comparing apples to oranges, because if you're in like a Facebook group and someone's talking about how terrible their life is because of rheumatoid arthritis, if they were diagnosed, like I know Colleen, you have a very unique, I'm just going to say, if those follow Colleen on Instagram, you have a very, very positive, like live life to the fullest, attitude. A lot of people who were diagnosed when you were 30 years ago have had have had a lot of negatives, but it can scare people who were diagnosed like in 2020 or 2021. They're like, oh no, is that what my life is going to be? But that's not your prognosis. That's what happened to them because they didn't have access to the treatments that we have now. So that's an important kind of framework to know. Okay, medications, again, we could do hours on medications. And again, I'm not a doctor, I'm not a pharmacist. So I would say pharmacists are like the unsung heroes of your medical teams. You can always, call the pharmacist, the one at Walgreens or the one at whoever you get your medications. That's part of their job, is actually supposed to be not just giving you medications, but actually talking to you about them, counseling you on them. But there's different classes of them. And you might be like, oh my gosh, I'm an acronym like overload here. Like, how can there be so many acronyms? We have disease modifying anti-rheumatic drugs. That's DMARDs. Those are things like methotrexate and Plaquenil. And then we have biologic response modifiers. Biologics, also confusingly sometimes called biologic DMARDs, because they do modify the disease. So these are ones that actually slow the progression of the disease. These are the game changers that make the prognosis better today than it used to be. There are also ones that address symptoms, like non-steroidal anti-inflammatories, which address the symptom of inflammation, but they don't slow down the disease progress. And steroids or corticosteroids. Those are not good for long-term use. You might have heard your doctor telling you that they don't want you to be on them for long-term. Typically, again, obviously take your specific doctor's advice, but because they can lead to osteoporosis and have a bunch of other side effects. And they are also immune suppressant, which if you're also on like a biologic or a DMARD, then it's just a lot of immunosuppression to have, like, especially right now during the pandemic, a little stressful time for all of us. Okay. Oh, I already kind of did this, but in the 70s and 80s, there was no methods to prevent or stop joint damage in RA. There just weren't. And so between the late 1980s and 90s, both the DMARDs and biologics came out, but they weren't really available to most until the early 2000s. So like I got diagnosed like right around when they were first becoming more available. So this is from a rheumatology journal, but I think it's a really important thing to remember. Like, current therapy for RA is such the progression from symptom onset to significant disability is now no longer inevitable. RA patients can anticipate comfortable and productive lives on medical therapy. So that's from the experts. Again, there are exceptions to that rule, but okay. So now I'm going to go through my actual tips. Sorry, that took so long. That's like setting the groundwork, setting the stage. So tool number one for navigating your new normal is actually getting organized. Now, getting organized might feel more overwhelming initially, but then once you get organized, it'll help you feel less overwhelmed. So you might be overwhelmed from just too much information, too many tasks. And so one of the things I like to do is use checklists. There's literally a book written by a doctor called the Checklist Manifesto. Has anyone else read this? It's a good book, but it's all about how important checklists are. But so I'm kind of a checklist freak. But there's a lot of information to learn after an RA diagnosis. And so having all the information in one place can be really helpful. So this is the old name, but I developed this little checklist and I'm going to email it to you. You can also download it at this bit.ly/RA checklist, case sensitive. And that hopefully will help you get everything in one place, kind of like your to-do list as a newly diagnosed patient. And a lot of these things, because it is chronic, you will continue to do. And those of you, I know there's a few that kind of trickled in, and feel free to ask questions in the chat or raise your digital hand if you have questions as I go along. Oh, you know what? I added a couple here and I think that they fell off. Yeah. Okay. I'm just going to do this so we can see all these. This is me being like a formatting geek. Okay. So you can also, a lot of times you're diagnosed by maybe like a general practitioner, doctor, or a rheumatologist, and they don't always tell you about all the other allied health providers that can help, but there's social workers, counselors that can help you adjust mentally, and social workers can help you navigate some of like the insurance insurance hurdles and burdens. I was saying burdles is a new word I just made up. And occupational therapists, that's obviously, I'm a little biased because I am one, but physical therapists help you definitely with strengthening. one thing I forgot to put in there, and not to give you like another thing to worry about, but is that people with rheumatoid arthritis are at risk of muscle weakness. So getting into a good exercise routine is really helpful. Of course, you have your primary care physician or nurse practitioner, and you can, I just found out my insurance, and this is not always the case, but mine covers for all qualified conditions. It covers unlimited sessions with a registered dietitian. So if you find one that really understands the nuances of anti-inflammatory like eating for, autoimmune diseases, that can be super helpful. Again, as I mentioned earlier, the pharmacist, and then psychiatrist or psychologist, if you're, again, no shame if you're struggling mentally. Yeah. And so Rebecca, I don't remember where you live. There are some social workers I know, amazing social workers in New York City. I always tell everyone to go to, Kentucky. Okay. I have to think about that and follow up with you. But yeah, another thing is, ideally your rheumatologist would kind of have their own list of like preferred recommendations of people that they've worked with in the past. It's not always the most exhaustive, but it's a good starting place, because it's nice if they actually know the person and can kind of vouch for them. And so tool one is just getting organized. I should say also keeping track of your medical records. I don't know why I thought that I lived in like a socialized healthcare system, but initially I thought that when people talked about like my medical record, it was like one, like, how when you're in school, you have a record, like your record of your grades, it's just one thing. So I thought that my medical record was just one record that was like a master record that everyone contributed to. I didn't realize that it was like every single provider I go to has their own system. Like, so some of you already understand this, but I was like, when I had to actually like, I tried to request my medical records later to get organized, it took forever. So nowadays with electronic medical records, I don't know about you all, but my doctors like usually will give me a handout each time of like their little notes, and that's really helpful. That's part of the record, or you can get it online. But there was definitely a period of time where it was like, I guess I have to be in charge of that. So tool number 2 is like taking care of your mind. I think, again, it's often overlooked. Everyone jumps to like, but I want to like figure out how to manage the pain and fatigue. And like, of course we need to do that. Like if we're on, Maslow's hierarchy of needs, we like need to take care of like the physical stuff too. But for me, the mind is just as, and the mind is part of the body too, right? So it's all one system. So thank you, Jennifer. Yeah, psychology today is super helpful for looking for therapists and or social workers, by the way. Yeah. Then you can search for like chronic illness. So we're going to look a little bit at just basic stress management, mindfulness, and you might have already heard of this. Some of you might be a mindfulness expert. So again, feel free to chime in, but this was very unintuitive for me. Okay. Being in the present moment, because if your present moment is uncomfortable, like you're in pain, why would you want to be in the present moment? Anyone else have that issue? You're like, no, I want to be in the future, the better future, not the current present. But I am a convert. Finally, it's gotten through my head. This being in the present moment without judging it, the reason that I have come around to this is that it turns out that is actually the only guaranteed thing that we have is the present moment. It's okay to still hope that the future will be, X, Y, or Z, but in reality, the present is the only truth. That's again, getting philosophical here. So like, I think that having a health condition, again, I'm projecting, if you're all like, this is not me, like, let me know. But, that you kind of want to, you get in problem solving mode. My therapist even said this exact words, like problem solving, he's like, you're a good problem solver. I'm like, thank you. And he's like, but you need to stop trying to problem solve all the time. And I was like, why? I'm good at it. He's like, because it's exhausting. Like your brain is like in fight or flight constantly. And it's like, we're being chased by a mastodon and we have to like run away. And like that's a really actually not good for your body and your brain long-term. Like being in that constant fight or flight is actually like very inflammatory. So it contributes to an additional, that was what actually convinced me. It's like, okay, well, I don't want to add more inflammation. So I got to manage my stress somehow. So that's, Rebecca, like a social worker that can help you with disability, that hopefully your rheumatology office would have someone to help you. And yeah, stress, there's lots of different theories and models for why people develop autoimmune diseases, and one of them is definitely that, childhood trauma or just any traumatic event can be that trigger. It doesn't mean, I had like literally the least traumatic childhood, like officially, like my therapist referred to my childhood as like a positive outlier, so I know that doesn't apply to me, but for many others it does, it does. And so absolutely. Yeah. The more we can do, I think mindfulness, being present, aware of the present moment without judging it, and learning how to observe yourself. You kind of learn how to be like, I'm the embodied self is how we normally think about things. But then, we also have like the observing self. It's like, I'm having these thoughts, and it's kind of an interesting thing to detach yourself from yourself. Anyway, this is a long thing that takes a while to learn, but yeah. And so, my other thing, I had two therapists, a psychologist and a psychiatrist. So when I might say he, I might say she, because the psychiatrist is a he and then the psychologist is a she. But so she, psychologist, said, she's like, you're always thinking about what's going to happen in the future. And I was like, right. Cause I'm like trying to problem solve all the things that could go wrong. And she's like, but your whole life becomes about this future that may or may not happen, when the present is actually what's actually happening. And I was like, whoa, you just blew my mind. So, right now, like you might still, again, you might want to be you're looking for tools for your toolbox to live a good life, with rheumatoid arthritis. And that's going to be section 3. I'm going to tell you some of those, but it's also one of the tools, paradoxically, is to say like, this is my now, like I do have some pain today. And what can I just be there for myself? Can I observe what I'm going through? And actually, so there's the mindfulness, and then there's also self-compassion, which I've only recently started learning. I think maybe my therapist tried to like get it into my head, but it didn't really sink in until recently, about saying, not just I'm in this present moment, but like, can I comfort myself? Like one of the exercises is literally putting like a hand on your heart and just saying like, can I have compassion for myself for what I'm going through? And it's like a oddly powerful experience. So acceptance and commitment therapy, again, those of you who follow me on Instagram are like, this lady like does not stop talking about acceptance and commitment therapy, but it's what's helped me the most. So it's about accepting your thoughts and feelings and your sensations exactly as they are, connecting with your values, and then like taking action. So instead of saying, how can I feel better, which is the problem solving way that I used to always look at things, and I still default to that, I'm not going to lie, but you say, what can I do right now that's truly meaningful, important in my life? Like, cause this, again, right now is my actual life, my present reality. And it's a empowering thing, because it just helps you connect to what's really going on. And you also, again, acknowledge and kind of, what's the word I'm looking for? Not just accept your feelings, but you validate your own feelings, and you're like, yeah, this sucks. Like having rheumatoid arthritis is not the best thing that feels the best for me. And instead of saying, well, I need to just think differently about that and think positive, you can also just say like, yeah, okay, I don't like this. This is not fun. But then what else, what can I do in my life that brings me joy despite this crap I'm going through? It's just a different mindset than the feeling better mindset. So in ACT, you don't care about whether thoughts are true or false or distortion. So those of you familiar with CBT, I was like CBT, cognitive behavior therapy. It's a little bit about, is this true or not? Like, am I having a distorted thought? You actually does not matter if your thought is true or false. It's, if I pay attention to this thought, is it going to help me create the life I want or not? And if not, maybe I should just pay less attention to it. So this is how I think about it. And this is a big slide. Sorry. So the biggest trigger for me for stress, I figured out over many years, was with regards to rheumatoid arthritis, is uncertainty. And ironically, haven't we all been living through a lot of uncertainty with the pandemic over the last year and a half? So that's been a good practice, painful practice for everyone. But let's just think of the uncertainty. Will my rheumatoid arthritis get better? Well, is this my new normal of like feeling physically this way? Or is it actually going to get better? Or is it going to get worse? Like that is a philosophically like uncertain situation. And it's really important to listen carefully to your medical team, because they can give you an idea of, in your specific case, with your blood work, with your family history, with your medical history, with how quickly we got it, with how well you're responding. I can give you, I think they'll say, I think you can expect to be getting better. You can expect to be getting worse, but there's no crystal ball. So they can give you their best guess. And that's important to get that data. But in reality, uncertainty is just a fundamental truth of our lives all the time. So people tend to kind of fall into one of three responses to uncertainty. There's positive thinking, like the uncertainty about whether your condition will get better. There's, it's going to get better. I'm going to learn how to control it if I just figure out how. And that is comforting to many. And if it works for you, first of all, if it works, it works. Do it. I'm not going to tell you not to do something that works. But long-term, it can be an illusion that's kind of not helpful. And then there's the door three, which is the doom and gloom, which is kind of the opposite of that. But it'll never get better. There's no hope. I might as well give up. And that's not helpful either, because it doesn't help you engage in your life. And so both of these are actually certainties. You're trying to respond to uncertainty by giving yourself the illusion of certainty. Door number one is positive thinking, like it's definitely going to get better. That's a certainty. And then door number three is it's definitely going to get worse. Like everything's going to suck forever. That's a certainty. So the only thing that has really helped to me, and that's the acceptance and commitment therapy way, is like the accepting the uncertainty. Acceptance in ACT in this therapy means taking what's offered. It doesn't mean liking it. It doesn't mean that you have to be happy about it or at peace with it. It literally just means acknowledging your current reality and your current circumstances. So this is what that's helped me a lot, is just saying it might get better, might get worse. I don't know. And I can still have a meaningful life despite this uncertainty. So that is a really big skill that, again, took me hours of therapy to get to. I don't expect you to like understand it in 3 minutes during this talk, but I will always want to, like, we kind of have default set points. Like I tend to be like the unicorn's happiness, set point. Like I want to go in door number one. And again, if there's times where it does work, like, then, if it's working and it's helpful, go for it. And some people have a kind of temperament that tends towards door number three. And then, so, I just have learned over time that flexing that muscle of accepting uncertainty is really helpful with a chronic illness that's, again, characterized by, at times, unpredictable flare-ups and remissions. There's a couple of these little social media quotes that go around that people seem to resonate with that are like, you can do everything right. You can eat the right foods. You can, do everything your doctor says. And sometimes you just wake up and you feel crappy. Like, and that's just happens. Like I'd say kind of not just accepting uncertainty, but accepting the randomness of health. Sometimes it takes that pressure off of you from the pressure to be perfect and do everything perfectly. Does that make sense? I'm kind of like a recovering perfectionist. So this is how I've come to all these things. Now, I'm going to contradict myself. As I said, I don't really like CBT sometimes. This cognitive behavior therapy. There's a lot of people in chronic pain that are very anti-CBT because it can be perceived, depending on who's doing it, as like invalidating your thoughts and feelings. So totally get that. I'm going to share with you what personally has helped me from CBT, which is becoming a thought detective. Sometimes it helps me to look at my thoughts and say, are these true or are these distortions? Because for me, sometimes my anxiety does kind of give me a distorted filter where I perceive more danger than is actually realistically there. So ANTs are see, I'm giving you so many acronyms, but ANTs in this case are automatic negative thoughts. Another thing that can happen is that our mind immediately goes to these black or white thinking and like negative thoughts in terms of things like, let's say, this is such a simple little example, but if I forgot my medication, I often will have this automatic negative thought. You're so stupid. Like, how could you forget that? You've had this for 19 years. Like, when are you going to remember, that kind of negative self-talk? And that's not helpful, right? We think sometimes that it's going to motivate us to like be, mean to ourselves, but really I could actually reframe. I forget if I have a slide on reframing. Oh yeah. No, I don't have a slide. I took out some slides, believe it or not. I took out some slides out of this 56 slide presentation for 1 hour. And so you can just say, you learn how to reframe them. So instead of saying, okay, I forgot my medicine, it means I'm a failure. I'm a terrible person. I suck, like I'm dumb, he's like, okay, that's a distortion. Like that's a lot of conclusions to make from one isolated incident. You can say, okay, another way of looking at this is I forgot my medicine today. I forgot this medicine on this hour, and that can be helpful, right? Now the reason that CBT is controversial with chronic pain is, again, having like a therapist or someone tell you that like, oh, your like thoughts about your pain are a distortion is kind of hard, because like, if you're worried, let's say your pain might not ever get better, like they can't tell you your pain's going to get better. They don't know. So why making you feel like that's a distortion is like, I have a problem with that personally. So, but it doesn't mean I want to throw every exercise out of CBT out with it. I don't really find it helpful with like pain necessarily, but I find it helpful with some of my self-talk personally. Like, even though I was raised in this very happy family, and everything, and like very like Mr. Rogers neighborhood, like kind of thing, I still sometimes have like negative, we all, I guess, are sometimes prone to negative self-talk. And yeah, brain fog. Oh, I'm just experiencing brain fog. You could say, oh, I forgot my medicine. We all have brain fog sometimes. The last thing is gratitude. So a lot of people do like to do like a gratitude journal. Again, a way to say, can I turn my attention towards what I still have alongside the grief for what you lost. I really don't like the idea of gratitude as a way to like shame you, or like, you should be grateful because it could be so much worse. Like you could also be starving, and you could, like, that's not what I mean. I mean, just taking a minute to say, what are you grateful for? What are you still grateful for? Even though you're in a situation that's not great. Like for me, okay, sorry. Can we just take a moment and look at my dog in this picture? I love him so much. But yeah, so in my life, for example, like, and this is a much longer story than just rheumatoid arthritis. I'm not going to tell it all, but we always thought we were going to have, 2 kids, and we have 1. And it is because of my health issues that we decided not to have more. And it's not, just for the record, it's not because I don't want to have my genes passed on. It's not that. It's just the physical, how bad my RA was postpartum, and a bunch of other things that had happened after having Charlie, that, it doesn't mean like I have to say, well, I shouldn't feel bad because I at least got to have a child. And it's saying, okay, I'm grateful that I had a child, and I can also grieve and feel sad that I don't have another child, which is something that I envisioned for my future. So that's the kind of gratitude I like, not to minimize your other feelings, but just to say, I'm going to take a moment. And, like there was, like, I think National Infertility Week was like a recently. And, I didn't struggle with infertility. I actually was really surprised when I got pregnant, because I was like, well, I have all these other health issues. I'm sure I'm not going to get pregnant easily. And then I did. And my husband and I were like, whoa, like we dodged like one health issue. So, that's where gratitude can be helpful. Okay. So now we're going to talk about the symptom management, tools to manage pain and fatigue. And this is called self-management, which I think is not a very intuitive like phrase, but self-management are just the tools that you use to cope with the day-to-day demands, the treatments, the physical and social consequences. I love that this is literally from a textbook. Oh no, sorry, this is from a website, but it was similarly defined in my textbooks in school. The ability of a patient to deal with all that a chronic illness entails. I love that they just say deal with, because it is what we have to do, right? Deal with all these things, being able to monitor your condition. And people who become good self-managers, or feel confident in managing their condition, are ones that are able to have a better quality of life typically. And so, yeah, it kind of includes the how of my master checklist. So some examples, you might get annoyed hearing this over and over, but there is a lot of evidence that gentle exercise can be very, very helpful for rheumatoid arthritis. But I get that it's unintuitive. If you're in pain, like why would I exercise? But there's many things that it does, and it actually helps the health of the tissues themselves. It can help decrease inflammation, and you have to find, this is the hard part, the just right amount of exercise for you. Like right now, for me, the example I always give is I do about 20 minutes of exercise on the exercise bike for cardio. And I also this summer decided to go on a 4-hour hike, and I knew it was kind of going to be too much, but it was awful, like how I felt afterwards. And it was like, well, yeah, for me, that was like obviously way too much of a challenge, right? But if I worked up to it slowly, I would be able to do that. Yeah. And Colleen, you have a trike. Some people do swimming. That's easy on the joints. Or there's people like my friend Christy. She's in medicated remission. She's literally running an Ironman triathlon. Like there's a huge range of what people can do, but it's all about just taking what you're currently able to do and seeing if you can just push it a little bit further each day. Like if you can currently walk 5 minutes, try to walk 6 minutes, and for exercise, you want to, long-term, it's going to be helpful for your body to mix strengthening, stretching, and cardio. So I really love stretching and cardio, and I don't love strengthening as much. So I'm totally been asleep at the wheel for that. But yeah. And so Tracy, and yeah, I think it's hard to figure out how you can integrate more. One thing would be like something really simple, like I call it habit stacking, or other people call it habit stacking, where maybe doing some lunges or doing a wall sit while brushing your teeth. So I'm trying to kind of do it. And let's say just strengthening. I think when people are tired with when they're having fatigue, it's hard to do more cardio. So doing maybe just a simple strengthening exercise, or like, when you get home, or when you're maybe waiting for the coffee to heat up in the morning, taking some cans of beans and just doing a little bit of strengthening. And every little bit counts. Ooh, a rowing machine. That's exciting. Standing Pilates with the girl with the Pilates mat on YouTube. That's awesome. I've heard good things about yoga with Adriene too. Yeah, walking the dog, just a little few. They call them, okay, this is funny. I just heard about this at the American College of Rheumatology conference. They call them exercise snacks. And it's like literally not food, but it's little, like you have snacks for food. It's like exercise snacks would be like, yeah, again, going up and down the stairs twice. Let's say you work in an office building that has stairs, going up and down the stairs a couple of times once an hour or something, like tiny little snacks are helpful. And then again, nutrition, I'll just be totally honest. I find the nutrition aspect the most complicated and overwhelming part of trying to figure out like lifestyle for rheumatoid arthritis. And that's why I did eventually go see like a registered dietitian. I'm like, you're the expert. You tell me how to sort through this. It's like everywhere you turn, it's like, you should do the AIP. No, you should do vegan. No, you should do keto. No, you got to do paleo. No, you got to do, there's so many, but just know in general, there's 2 different approaches. I try to like distill everything down to its most simple parts. It's like, you can add foods that are anti-inflammatory, or you can cut out foods that are pro-inflammatory. Like those are your 2 options. And you can go to the wild extremes of either one of those. But I think the more fun one is to start personally with adding the anti-inflammatory foods. So saying, don't just think, oh, I need to stop eating these foods I love. Just saying, oh, okay, hey, these like fruits and vegetables and nuts are anti-inflammatory. So I'm going to eat a little bit more of those, as opposed to that kind of restriction mindset. Like I have to cut out all these foods, or maybe just slightly cut down, maybe like on highly processed foods. And then, protecting your joints. Of course, I'm in a different place than I normally am. I have an ergonomic vertical mouse that you hold it like this, versus this is my like travel mouse, the normal design. It seems weird, but just this amount of difference can really help with wrist pain. And then getting a toolbox of pain relief items, like a weighted blanket, a creams. There's all sorts of creams. Some people do CBD creams. Some people do the Voltaren gel. I like BioFreeze. There's also compression gloves. This is my friend Sarah from Grace and Able designed these to be not ugly. That's a thought. Let's make some arthritis equipment that's not super ugly. It makes us depressed. So she made cute colors of compression gloves. And then starting a mindfulness practice for self-management, stress management. A lot of people love these apps like Headspace, Calm, and also like, I forgot to mention sleep. So exercise and nutrition, everyone always talks about, diet and exercise. Sleep is super important for autoimmune disease and for rheumatoid arthritis. It actually is like directly can reduce pain, which seems weird to me. Like I would think, wait, when you're in pain, you sleep worse. But actually, they also subjected people with rheumatoid arthritis in a study to a sleep deprivation group. Isn't that awful? Like, I would never, you have to pay me like $1,000 to do that. But like, they made people with rheumatoid arthritis sleep for only 4 hours and their pain shot up like crazy. So I'm sorry, try not to use the word crazy, like a lot, significantly. So yeah, sleep is hard. Sleep is hard. Just any little thing. Like there's this book I read, James Clear, Atomic Habits. I'm going to put it in here because it's really helpful. He says like something like, if you just focus on doing 1% better each day, like just trying to say, can I do one little thing? For me, let me tell you, the worst thing for my sleep is this little shiny object, the phone. They always, all these lists of what to do to sleep better. It always says, put your phone away. Do not look at your phone an hour before bed. I have done that like 2 days of my life, but those 2 days I did sleep better. I just cannot bring myself to keep doing it. But, just make your bed and your sleep environment as comfortable as possible. It can be something as simple as, again, it's like adding something positive, like with the food, adding something that makes you more rested, or taking away something that decreases your rest. Oh, we've had a big conversation with this in the Room to Thrive group. A lot of us are fans of not sleeping in the same room as your significant others to maximize your sleep. And there's no shame in that as well. So, okay, I'm sorry. I'm going over a little bit. Those last slides I'm going to go through quickly, but protecting your joints with little gadgets. I mentioned earlier the hair dryer stand. I also have like adaptive scissors like this that protect your thumb. I have a whole page on this on my website, which I'll put in the chat or in the email tomorrow with the recording. You can use ice or heat to help with pain relief. And again, weirdly enough, exercise, actually, people who exercise do show less pain levels, even when it's not just a correlation. It's like they'll assign, like in a randomized control trial, assign half the people to exercise and half of them to not. And it can be just as simple as like, 15-minute walk and like 10 minutes of stretching. So, and it can be throughout the day. For cardio is the one. Cardiovascular fitness, you do need to get your heart rate up for a longer, like a period of time, at least 10 minutes sustained, because that is going to actually contribute to endurance, like muscle endurance and heart endurance. But in terms of strengthening, it also depends whether your goal is endurance or strength. But point being, if you're overwhelmed, just do something. Do 1% more than you did yesterday. That's what I tell myself. And then for fatigue, chunking your tasks. If you've heard of the spoon theory, spreading your spoons throughout the day, delegating to other people. Okay, I'm not even going to worry about that slide because that's too much. So tip 4 is just getting support. And I have my own support group that I run, but there are lots of others. Sometimes there's ones that are led locally, like through nonprofits, like the Arthritis Foundation. They have one that's a monthly support group. It's once a month, but it's great. It's like, even though it's online right now for most places, they do have people in local pods, I guess you would call them. So, and there's also a difference between ones that are like patient-led versus hybrid ones that are like professional and patient-led. So it depends on kind of your preference. But okay, take a second. I'm going to breathe. Feelings are for feeling. That's another thing that I learned that from Glennon Doyle Melton, who's an amazing writer. Validate your feelings. It's a lot. So the recap is get organized, take care of your mind, learn the tools for pain and fatigue, get support. And then in general, just know that, there's a study from 2015, EULAR, European League Against Rheumatism. They just changed their name to something else, European something rheumatism. But a lot of people don't get enough information on the patients report that they don't have enough information and support. They want to actually learn how to live with this, and they want support beyond, medications. So this is my little spiel. I'm not going to go this very long because I want to definitely make sure we have time for more questions, answers. But, people, you can try to figure it out on your own. But I do want to make sure I tell you that I do have 2 little programs. One is a self-paced online course called the RA Roadmap, and one is the Room to Thrive ongoing support group. So in both of them, they have overlapping content. It's a little confusing. They're not mutually exclusive. People who have done both, but the roadmap is more if you just want to go through things on your own. And I am going to do a giveaway. That's my exciting announcement. I think I already said it in like the email because I can never wait. But I'll announce in 2 days who got the free Rheumatoid Arthritis Roadmap course. And then I'm also going to do a little like discount, a Black Friday discount. And I started Arthritis Life 2 years ago. And to be honest, I'm still learning. Like it is it is a small business. It's a small business. It is a for-profit, but I set it up that way because nonprofits are very complex and there already are arthritis nonprofits. So I also wanted to be able to provide occupational therapy. So long story short, I just want to be transparent about that. But I'm doing my own programs the way that I like to, because I like control. I'm still working on that. But I've gotten some really good testimonials. I'm honestly waiting for my first negative feedback because I just want to get it over with, because I just wanted not have to worry about getting negative feedback. And then, this is what Pamela said, that she found that it was really helpful, and that I do the Room to Thrive group. It's a cohort. And I just do it twice a year just for my own energy conservation. And the next group is going to start in April of 2022. So if you go to bit.ly/roomthrive, so I'm going to do that, put that in the chat. There we go. That is how you can add yourself to the wait list. And we have weekly meetings, and I deliver a lot of this kind of information, but one topic at a time. And so I liked this testimonial because this is really my goal, is to be upbeat, but also compassionate and honest and validating and hope. That's the goal. So, okay. So this is how you can find me. Again, I'm sorry I went over. I always do. I try so hard to get as much in the time as possible. I know a lot of you are on the East Coast, so it's already bedtime, but I'm going to stop sharing because I'm going to send you all these slides and the recording, but I'm glad it was helpful. Whew. Any questions? Thank you, Colleen. I can see some claps. Yeah. I hope this is, again, I have other trainings I've done too. I am working on getting myself better organized and my website better organized, because it's a little bit scattered. I like to make content. I like to make videos and content. I don't like to organize what I've already made. So I'm learning, but okay. Oh, it doesn't look like there's too many questions. You're welcome. Yeah. Oh, and if you want to ask something off the record, I can pause the recording. I totally forgot to say that earlier. So if you want to ask something and not, because I do want to really, again, respect people's privacy. But oh yes. Oh my gosh. Thank you, Rebecca. I completely do need-based and student discounts. It's, again, because this is Arthritis Life is a one-person show. It's me. So I'm literally just, it's I think some people call them a pay what you can option. So I definitely do that. And I say it on the page, but I didn't say it on the slides. So thank you for reminding me of that. Oh my gosh, Casey, I love this question. What are some examples of hobbies people with RA enjoy despite their joint pain? I would love all of you to share. I mean, I will say that the answer for me in the last 19 years has depended on my disease state, right? So when I was in medicated remission, I did swing dancing, and that was my favorite hobby. I actually did that even through my pregnancy. But then since postpartum, it hasn't been as sustainable for me. Partner swing dancing requires a lot of holding the hands. And of course, right now with COVID, it's also not very COVID safe. So swimming, painting, Colleen, photography, gardening, watercolor. Oh my gosh, so many good ones. Dancing, bike riding, playing video games. Yeah. Ooh, I like kid video games. I play this one called Rayman Legends, which is apparently just a kid game, but my son and I are really close to beating the whole game, which is really fun. Paper painting, collage. Nice. All sorts of games, board games. Oh, that's fun, Rebecca, that you yeah. Oh, spending time with animals. That's what I was going to say. This is my hobby. Let me get my little buddy up here. This is Teddy. I want to train him to be a therapy dog because he's so chill. Doesn't he look like a stuffed animal? He's just do. I'm just hanging out. He's so chill. Yeah, in the group. So we actually do in Room to Thrive. I get a little bit carried away with acronyms. So Thrive is an acronym that stands for the T is tools for pain and fatigue. H is habits. R habits diet, exercise, nutrition, exercise, sleep is one of the habits. R is relationships. I is inner world mental health, and V is valued activities and hobbies. So, and then E is executive functions, becoming the CEO of your care team. So the whole V section, that's a whole month, is on sharing. It's like we do a show and tell on people's valued activities and hobbies. And yeah, singing is a good one. Singing, music. A lot of people love music. Video. I like doing video editing. And there's a lot of people with RA that like to do fine arts, like even things that you would think would hurt your hands, like clay and stuff. Okay, Nicole, that is like such a timely question. I literally just filmed a video on Saturday on hand stretches for RA. I haven't put it on YouTube yet, but I will send that also. I'm putting this in here. Reminder to Cheryl to send. Oh no, I'll just use your comment will be my reminder to send. And there's also I've written a couple articles about them, but a couple good ones are like putting your hands into a fist and then slowly opening them and then putting them back in. That's like called that's like a tendon gliding one. You can also go like this to make it like a sloth and then down. That's actually good. And then so there's all these different joints, right? There's the wrist back and forth, there's the wrist up and down, there's the fingers out, that's extension, and then the fingers in, that's flexion. And then there's also fingers towards each other, that's adduction or adduction, and then there's fingers away from each other. Sorry, that's abduction, abduction, fingers away, fingers back together. So you think about like with stretching, you want to think about like what is the range of motion that the joint is designed to go through, and you want to maintain that, because a lot of times when we have a condition that causes some pain, we tend to kind of protect our joints and then like stop using them, and that can actually contribute to the deformities or differences that can occur over time with rheumatoid arthritis. Yeah, and okay, Rebecca, you have putty and stretch loops from your OT. So if you do go to an occupational therapist, particularly if you go to a certified hand therapist, which is either an occupational therapist or physical therapist with 5,000 hours of additional training in the hand, and they have to pass a really rigorous exam, and it's a very intense thing. It's a very prestigious. I am not a hand therapist, just FYI. I'm not a certified hand therapist. I'm an OT, regular occupational therapist. But they can also look at your specific issues. Like I have a couple issues in my thumb. Like I don't have the regular range of motion. This is as far, it's hard to say, angles are hard. I can't make my right hand do more of an L with my thumb. I can't, this is as far as it goes. Like, whereas, you know, this is more normal. This is not. And then it's so it's a little stiff, like it doesn't go out that way. So she would give me specific exercises for that and ways to strengthen it as well. So hopefully that helps a little bit. Oh, we have someone in the waiting room. Oh no, I hope we didn't get the time difference wrong. Yeah, any other questions about, yeah, I love the question about hobbies. Oh, stretching your hands in a big container of rice, or what's it called? Paraffin wax. Like you have those little ones for the nail salon. So let me put, actually, I have this little, and this is just good to share for this time of year, because we're in like a little bit of a shopping season. I have a list of my favorite arthritis products that includes things like the the gloves and the heat packs and cold packs and stuff. Oops. Okay. Yes. Sorry. Thank you, Nicole. Yeah. I should have done this way long ago, like a hand stretching video. I don't know why I didn't. Someone else asked me and I was like, oh my gosh, how do I not have a hand stretch video? That's like OT 101. Okay. Yeah. Okay. So my favorite arthritis products, those who just joined. Oh, oops. We just finished technically. I'm sorry for those who just joined. I don't know if I got the time difference wrong or what, but we're doing questions and answers now for this is Teddy. We're having a little puppy therapy. Or maybe it was people who lost their internet and came back. Hopefully that was the issue. But that's the arthritis product list. And then that is like technically an Amazon affiliate link. I've like made $12 total on it. It's just to give easy links. Oh, and this is the information about the roadmap. just so you know. But yeah, yeah, any just general, I know right now is a hard time again to be living with rheumatoid arthritis with the pandemic and everything, but hopefully everyone was able to get some good care through like either telehealth or in person. I'm seeing my rheumatologist in person. That's a, you can't always see them through telehealth because they sometimes need want to do a little what they call palpation of like your joints. So I don't want to keep you all too long though. Is there anything else? I always go over. I should have said that in the beginning. Or I always stay longer to answer questions, but I will be sending a replay of this. It's being recorded, and then doing a little giveaway of the RA roadmap, which is just it's me talking you through all these things in a longer format. Here's all the details on the pain relief. Here's all the details on the, some of the coping tools. So, I'm so glad it was helpful. Yay. I get a little excited, if we were all in person, it would be even more I would just explode because I love meeting people who have we're sad that we all, it's like, how do you say it? Like, I'm sorry that you're here, but given that you have this, I'm glad that we can connect. Like, that's what I try to say, not like, yay, we have arthritis. Woo. Like, I know it's not the best thing, but it is what it is. So thank you all so much. Looks like, and I'm sorry again, those who just came on, it's over. I'm sorry. But I'm happy to answer any additional questions, and I will be sending out the replay to everyone who registered. So good to see you all. Thank you. I'm going to close this up. Bye.